Hello everyone, today in this video we are going to learn about the external obstetrical examination. Explain for pregnant women about the examination. Then wash hands dry with a disposable towel. Take on disposable gloves. Tell about the position. Lying down on backside with bend her legs. Add the cox femoral and knee joint for relaxation of abdominal muscle. Stand up with face to patient to right side from her. Let's start the method. The first method. Palms of the both hands are situated on the fundus of the uterus with fingers, ends of the arms directed to each other, and find the height of standing of uterus fundus, his side, presence or absence of the big part of the fundus and height of fundus over the pubic. The second method, palm of both hands put on lateral part of uterus from a fundus. Palm surface of arm where palpate the lateral part of uterus, changing the action of the left and right arms. Receive the conclusion about the situation of fetus, back and small parts. Make a conclusion about the position, view of fetus. The third method, determine the presenting part of fetus. For the palm of the right hand, we are putting over the pubic and finger are taken presenting part. Finding a hard and balloting part, we think about cephalic presentation. At finding of soft and non-balloting part will tell about the pelvic presentation. For performing the next method, investigator is standing with face to leg of patient to the right. The fourth method is the determination of coordination of presenting part with plain inlet in small pelvic and useful in labor. Palms of both hands are situated lateral from the middle or line over the horizontal branches of pubic bones. Palms are situated lateral from the middle line over the horizontal branches of the pubic bones. Constantly changing the position of the fingers between the presenting part or plane inlet, we check the relationship of presenting part to the plane of inlet. Make conclusion on the basis of receiving the data about the fetus side position and view. Take away gloves and throw away the container. Utilization, wash our hands.